Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. As the Governor noted, and occasionally happens, we'll be posting the new cases later this afternoon, and we'll get our updates at that point. It's important to know the cases are increasing, and it's something that we can, at this point, do something about. We have the systems that have been built, as the Governor mentioned, at the state level that are in place, first-in-class testing, amazing work with our case investigation and contact tracing, our ability to help ensure that people are quarantined and isolating appropriately. The key that's going to get us through going forward is the tangible steps that you can take and you can encourage for the people around you. So as the infectious disease physician here for adults and kids, I want to continue to make sure that you have the science and the understanding behind why we're saying what is going to work to help us get through these next few months. And we've made it our duty to share with you as we learn what's happening. We did that in June when we saw with the protests, thousands of people came together. When masks were worn, we saw an extremely low % positivity among the folks who got tested after the protests. Bottom line piece of science, masks work. The next update is something that the Governor just shared. With our colleges and universities, students at the beginning of this semester took very seriously the understanding that they needed to quarantine prior to arriving here and needed to quarantine upon arrival before they got tested in order to get going with classes. And students did that, and when they did it effectively, it worked. The % positivity was extremely low. And when Dr. Birx came to visit with us and has continued to engage with us, she's confirmed that nationally that was found. So we want you to understand that science of both stories. Wearing a mask works to stop transmission, and when you stay local, when you avoid social gatherings, when you avoid non-essential activities, it works to stop transmission. So we want you to apply that across the board, especially when you're looking at the people around you who you know, who you love. We talked last week about the fact that that's when people's guards are down. When you're around people in a casual setting, you see your coworkers every day, extended family members from outside of your household, close friends, they look fine. People think everything is fine, their guards are down, they take their masks off. That's exactly where we're seeing transmission occur. That's the primary place where we're seeing the striking increase in our numbers. So we want to make sure that you have the science behind the information to help us stop this. It's wearing your mask, and it's wearing it with anyone you interface with that you don't live with. Whether you work with them every day, whether you love them because they're a family member, whether you know them, whether they look like they're fine and they don't have any signs or symptoms, that's exactly where you need to wear your mask and stay local. The smaller your groups, the better. The more you avoid social gatherings, the better. As we're going into Thanksgiving, Halloween, Thanksgiving, all of the holidays that have been mentioned, as a society, we socialize during those times. So it's important for you to know the key things we need to do differently in our effort to stop transmission of coronavirus and to stop the increases in cases. We may work with our colleges and universities to tell students before they go back home for Thanksgiving, also stay local, avoid non-essential activities, avoid social gatherings, so that when they go home to their family members, they can be assured that they're keeping them safe. This is about how we're protecting those that we know and that we love that are around us, in addition to what we have said previously, which is how to show that you care for people in public by wearing your mask. It's also taking these steps, wearing a mask, and decreasing your social gathering, social activity prior to engagement with people outside of your household. Those are two critical ways to stop transmission of coronavirus. So we want to make sure that as these holidays are coming up, you are equipped with tools that you can take with you and have that add to the systems that we have built that we know are in place. It doesn't matter if you're not able to do the things that you can do that we know will make a difference. Wearing a mask and staying local, avoiding social gatherings, avoiding non-essential activities. Think about all the different places where you can do that, particularly before you're going to see someone who lives outside of your household, even at a small gathering event. We know it's less than 15. The smaller the better. Keep it to 5. Keep it to 10. The fewer people you're engaging with, the less likely coronavirus transmission is to occur, and particularly because for the holidays you will be engaging with people that you love. This is the time more than ever to make sure that you're wearing that mask, and before you engage with those people, however small that group is, do these things like not going to social gatherings up until then, because any interaction you have with people without wearing a mask is increasing your risk of developing coronavirus and passing it on to grandma or auntie or your uncle. It's the ultimate way to show that you love them. How do we limit these non-essential activities and limit social gatherings? Just think of how often you are with people outside of your household in those socialized settings, and really stop those activities. Focus on going to work settings or wearing masks, they're structured. Focus on going to the store. In our store and retail settings, they're structured, there's distance, you're wearing a mask. Go to the pharmacy, go to the doctor's office, do those essential things that you need to do, but avoid the non-essential outings, the non-essential gatherings of people coming together where your risk is by far the highest. As the governor said, we're urging people to stay local and have Thanksgiving just with the people that you live with. The smaller the group, the better. Limit it to 5. Limit it to 10. You don't have to go to 15. You should not go beyond 15. The smaller the group, the better. Everyone wearing their mask is critical. Once you're with members of your family or people that you know that are outside of people that you live with. One other note we should all remember is that there are people who don't live with a partner or other family and who live alone. We need to stay connected to each other right now, especially people who do not have that support network within their own home. The holidays are a hard time for some people sometimes, and this year it might be even harder. So keep that in mind. Drop off a meal for someone, pick up the phone, have a Zoom get together. Let the people in your life know that you love them. That's important for all of us to be able to do. And limit the in-person gatherings to just the people that you live with. Another note on Thanksgiving is that the holidays sometimes cause stress within families. This year might be even more so. There may be hard conversations or different opinions about how to spend Thanksgiving this year. Let's all try to be kind to each other and patient with each other, especially with the people that we love, that we know, that we work with. Let's encourage and uplift each other. We all need to be extremely vigilant right now. I want to reiterate something I stated last week, that if anyone in the household has symptoms, everyone in that household should stay local in order to understand what is going on, particularly if the symptoms of that individual are more likely to be COVID-19. Symptoms of new cough, of difficulty breathing, or loss of smell or taste. Those are symptoms in particular that if one individual in the household has a new cough, difficulty breathing, or loss of smell or taste, everyone in that household should stay home until there's a better understanding of what's going on. That's a way to keep transmission from occurring. That person who has those symptoms absolutely should be tested. Any kind of symptoms, certainly the ones that are more likely to be COVID-19, new cough, difficulty breathing, loss of smell or taste, you should absolutely be getting tested. And everyone in that household stay home from work or school until all of the sick person's tests are received, their rapid tests and their PCR tests if they have both. In addition to testing for symptomatic people, we also have a testing program for asymptomatic people that the governor has mentioned. If you don't have symptoms, it's particularly for people that fit into these categories. Travelers outside of the state, people between the ages of 18 and 39 years of age, people who work in settings where they're coming in high contact with other individuals. The governor really acknowledged the folks who are on the front lines, first responders, folks in restaurants and grocery stores, barbers, bus drivers. High contact workers are also people we're encouraging to get tested. And then people who have attended some form of gathering where there were more people than there should have been, or folks weren't wearing their mask. We have the testing capacity that we're expanding to make available for those people without symptoms, particularly falling in those categories, to go get tested. And the key difference to tell you is you can get tested weekly, get tested regularly, being able to go back, particularly if you're a high contact worker, teacher or otherwise who's continuing to go to work and do the important things that you're doing, you can continue to get tested on a regular basis. That's what we are opening up and want to encourage weekly, whatever works for you to be able to do. Separately, I want to say a word about business compliance. As I said last week, we are getting more serious about enforcing compliance with mask wearing, knowing how critical it is, and our other public health requirements in business settings. Thankfully, and it's why we're encouraging it, most businesses are doing a very good job with this. It's why we are saying it's okay, go to shop, get what you need, and then return back. But we still have some room for improvement with a small group of businesses. For example, if you're not wearing a mask and you are a barber, we are going to close you down until we can be sure that mask wearing is happening. It's too critical right now. In an office setting where employees are not wearing masks in common areas, we are going to issue fines for each employee without a mask on. The same goes for people in food services or in other entities. Like I said, most people are doing well, but we want to focus in, because this is such a critical activity, we want to focus in on the ones who aren't and make sure that mask wearing is occurring. Shifting gears, as I do every week, I want to provide an update on what we are seeing in our case investigations. Between October 6th and October 12th, we identified 1,209 new cases. Younger adults between the ages of 19 and 24 continue to be disproportionately represented in our case data. While this age category comprises 9% of Rhode Island's overall population, it represents 21% of Rhode Island's cases during this week period. While transmission in informal settings between acquaintances and friends continues to drive our case numbers, we are also seeing a lot of workplace-associated cases, particularly in areas where people are socializing and gathering together, not in the structured part of their work environment. We know that break rooms, carpooling, and improper mask wearing are factors that are involved in most of these cases. Something else we're seeing is cases associated with religious gatherings, also where socializing is occurring. People's guards are down, you're with people you feel comfortable with, they seem to look fine. That's where we need the message amplified. It's the most important time to wear your mask. Between October 6th and 12th, there were 30 cases in which someone reported attending a religious gathering. We've been working hard to get guidance out to faith leaders. We had an excellent call with faith leadership this week, and they're going to join with us in amplifying this message, even when it's comfortable, even when you don't think it's needed. Mask wearing and that distancing is critical. Something else that we're seeing is an increase in the social gathering size. The average social gathering size for this particular period, October 6th to the 12th, was 27.6, which is an increase from the prior week's average gathering size number of 22.9. That's going in the wrong direction from what we're trying to say. Go even smaller, stay local, wear your mask. This trend is compounded by the fact that many people who have reported having attended a social gathering initially are refusing to provide information on the size, the location, or the attendees at that gathering. This is harmful for all of us as a state. We need you to cooperate with us. When you test positive after attending a social gathering, if you then decide to not provide information to the Rhode Island Department of Health when we call you, you are potentially contributing to serious health consequences for the people around you, the people that you know, the people that you love. We will only ever use the information you provide us to help the people around you. Another ask I'm making is to please answer the phone the first time that our case investigators call. Again, this is about the partnership. We know what we have at the state level. Here are the tangible things, all doable for each of us to do to help get us through this together. We are confident that we can turn our case numbers around and start moving in the right direction again, but that's only with you doing your part.